Something is demand inelastic when the desire for something doesn't change much with the price. For example, gas in your car. Whether the price is $2 a gallon or $5 a gallon, people still want gas and they're still willing to pay. And people reduce their use of gas very little in response to a rise in price. It takes a very high price rise to deal with just a tiny shortfall in the supply of gasoline, because everyone uses their car, everyone wants to use their car, and very few people are willing to cut back, and they just take it when the price goes up. Only a few people stop using gas, and that allows the market to clear. Medical services are the same way. Whether it's cheap or expensive, people still need medical services. When they need it, and they're willing to pay, not anything, but they're willing to pay quite a bit. And so whether it's cheap or expensive, they're going to have to get medical services. Very few people are willing to cut back on medical services when the price goes up. Medical services, like gasoline, are demand inelastic. I'm sure you've heard many times that the cost of medical services has gone up substantially in the United States, and linked in the description will be sources that talk about this, but I don't think that's really in dispute. Unfortunately, in several of these things, there is an immediate rush to explain why this is happening. And let me give you my explanation. The number of doctors graduating from U.S. medical schools has been about the same since 1982. Meanwhile, the population of the U.S. has gone from 231 million to 312 million in 2011, and this population has aged. So there's more people, and a lot more old people, but the same number of doctors. The problem is that supply is being restricted, apparently because supply is not responding to demand. The United States government, not just private spending, but government spending on medical services, is higher than the OECD average as a percentage of GDP. That's something not a lot of people know. The United States also spends more than the Canadian government on medical services as a percentage of GDP. Canada, right? So people who claim that the U.S. medical industry is left to the market, that's why it's so bad, apparently just haven't looked at the data. Now, it's true that in the U.S. Private market spending is greater than public spending on medical services, but it's also true that U.S. government spending is greater than Canadian government spending on medical services as a proportion of GDP. And so people who say that that's why it's so bad, apparently they just haven't looked at the data. At least that's the only way I can conceive of them coming to such an anti-factual conclusion and saying we need more government medical services. Like what? Do you think spending more is going to do something? The U.S. already spends more than Canada, already spends more than the OECD average, doesn't spend the most. The U.S. government doesn't spend the most as a percentage of GDP than all governments on the world, but it's near the top. The U.S. doesn't have a single payer system, like or doesn't have a nationalized system like the NHS. Okay, so when that happens, when the U.S. has a single payer system or an NHS style system, will the restrictions on supply go away? How will that solve the problem? They didn't go away when Medicare or Medicaid were instituted. I don't see how a nationalized healthcare thing is going to solve the base problem, which appears to be a restriction of supply. I encourage people not to take my explanation of restriction of supply as the explanation. I'm sure there are many explanations. I'm sure there are. I believe that that restriction of supply is a factor, but it's not the only factor. But really what I encourage people to do is to get out of this sort of political storytelling and just look at data. There is something seriously wrong with supply, or the production of medical services in the United States, and instituting the equivalent of the NHS in the U.S. is not going to fix that problem. And for people who are interested, who are big-time social democrats, it may not even result in an increase in total spending, in government spending on medical services. I mean, the U.S. already spends about as much as Britain. the government does as on medical services as a percentage of GDP. So I don't know what you think an NHS system will do, except maybe spend a little bit more, but it's not in Britain. And that system doesn't solve the whatever's going on with supply, whatever's keeping supply down and resulting in a ballooning in prices in the United States. I believe that the main problem, is that supply is suppressed. Others say that there is just a tangle of bullshit and all these different organizations and all these different forms and crap you have to do. There's just a tangle of bureaucracy that's causing problems. Others say it's lawsuits and all that stuff. And all that stuff sounds plausible to me. But what I'm saying here is, let's get out of this sort of storytelling about medical services. There was a video made a while ago, not made by Schwanert, but mirrored by Schwanert, and he titled it "A Response to the Insane Anti-Healthcare Morons," which was against people in the United States being against an NHS-style system. Apparently assuming that all the problems in the United States are because the U.S. doesn't have an NHS-style system, which just, it doesn't make any sense, quite frankly. That's what I want to say here.